At this time, we will now invite questions to the speaker. Anyone with a question, please go to the center aisle and use the microphone. Thank you.
Shall I make the question in English or in Portuguese?
No importa.
Portuguese. Will that be translated?
Yeah.
Okay. I was
Jorge, I'm very happy because I'm a clinician and I practice medicine and I have the weight of being a researcher, and we can dream. We have no responsibility. We can use our intuition. That's all right. There is a very strong current of people, integrative medicine and functional medicine, and researching the multiple sclerosis, Parkinson, and other degenerative type of diseases that are very connected to the mitochondria. Do you have anything on that? Do you have any experience to share with us? How the interaction happens? Well, the mitochondria is now in it's being talked about, and I have been reading several articles, and we have lots of diseases that are related to the mitochondria. There are very seldom and rare diseases, the muscle skeletal type of diseases that are very severe, and my challenge now is to see the integration with between the mitochondria and the tubulins, and this is the way, I think. And the mitochondria, since it has a mental body signature, the integrative medicine will bring some relief of patients that you see, right, with severe diseases that need rehabilitation. I always have access to these articles, and I can share them with you, and we can exchange emails so that we can speculate the other side and leave Giancarlo the work of scientific proving that. Why is the tubulin important? Dr. Nobre asked. Well, Dr. Nobre is talking about the importance of tubulins. To talk about that, in the SMAs, we have a task to study how the consciousness interacts over the physical body, and Roger Penrose, based on from the Oxford University, Roger Penrose's studies and ideas, he brings the concepts that consciousness comes from the 0 point of the Planck scale, where the Platonic. This is the Penrose text that talks about that, and it interacts with the physical body and this in the brain. So the consciousness, it's not a product of the brain. It only receives and it reacts in the quantum interaction. And Dr. Schultz-Hameroff from the University of Arizona, he brings his studies on tubulins, and they work in the neurons as a quantum systems. And there was the marriage of Roger Penrose theory that the consciousness it is expressed in the 0 in the Planck scale, and we need a quantum scale for them to express in the brain, to be expressed in the brain, and Dr. Hameroff saying that tubulins are these quantum apparatus. And this is in accordance with what André Luiz stated in 1958, that the mental body is connected in the cell from the cytoplasm. And the tubulins are in the microtubules that are cytoplasmatic structures. And Dr. Hameroff says that tubulins within the neurons are clustered in such a way that they allow that consciousness phenomenon can be produced. And we speculate and say that the first connection is done through the pineal gland. And Dr. Daniel Cardinelli, he also publishes a lot about the pineal gland, and he has been demonstrated since 1975 that this gland is not simply an appendix that is buried in the brain. It has this fundamental role in the immunological system, in sleep, control, and a direct integration of the melatonin, which is a hormone produced by the pineal, and with a peptide that is produced in the thymus gland. And when we get to the suppression of the gonads don't appear if there is not such signaling. So pineal gland is much more important than we think. We have been studying the thought and the process of thinking, and we are trying to marry the concepts of André Luiz with Dr. Penrose and also David Bond, talking about implicit orders, and Dr. Marlene Nobre is coordinating this group. There are several groups in the Spiritist Medical Association there, because she's a visionary. Dr. Nobre is a visionary. I think nobody is more updated than she is. We really are trying to understand all of this by reading all these articles. Daniel Cardinelli. I have two questions. Thank you for your lectures. I have two questions. First is for Dr. Alessandra. The patients in psychiatric hospitals, are they spiritists or they are from the general population? General population. Usually the spiritist hospitals, because of the philanthropic nature that they have to see patients from the Social Security in Brazil. It's the Brazilian Social Security version, and there are some patients that are spiritists and others that they profess another religion. And there in Brazil, this is a law. You have to offer the religious support. It doesn't really matter which hospital. If you're evangelical hospital or in a spiritist hospital and you want to have contact with his or her patients, the patients can, pastors or bishops, whatever, it doesn't matter. They are to get to the hospital and they are to be seen. And now is the question to the doctor. I forgot the second question I was going to ask. Well, in these studies that you say that you're trying... No, I remembered. The original question that I was thinking of is that I heard that there is some sort of document or article that is analyzing all the works of André Luiz, especially what it has to do with things that he talked before his time, be it technological in nature or scientific concepts that then it was then proved to be true. So do you know anything about that? Any studies? Is it critical studies? Historic or critical? Well, Dr. Marlene Nobre, she has a beautiful lecture in which she goes point by point demonstrating some of the André Luiz revelations before his time, and not even in medicine, not only medicine, but also in scientific and technological issues. The book Mechanisms of Mediumship, in which he talks about physics. André Luiz talks about physics and the quantum physics. This book received some criticisms by spiritists that have a certain difficulty in relating to Chico Xavier, and all the criticisms were answered and replied, because what André Luiz brings in Mechanisms of Mediumship in this book, he brings this concept that Professor Riggs, 30 years later, will state and calls field of Riggs, or Riggs field. It's the universal field is something with no matter. It gives property to matter, but it's not matter. And then we were very happy with the possible discovery of the theory of the Riggs, field of Riggs. And Louise speaks in chapter 4 about that in this book, Mechanisms of Mediumship. I don't know if this book is for sale or not. Here. Since it is the last question, because I'm the one controlling the time, I know it's the last question. Dr. Alessandra. Someone asked me yesterday, and I think it would be very interesting for all of everyone to know here, if in the Spiritist hospitals, if you have equipment for X-rays or to doing CT scans or MRIs, or if you have all this equipment there, as other hospitals are equipped with all this, like general hospitals. The characteristic of the psychiatric hospitals is because they have no imaged sort of equipment because of the disease. But within the spirit hospitals, we have the traditional, the psychiatric treatment that is carried out. And when my friend asked about the population that goes there, if the patient is schizophrenic, of course, they will receive drugs for that, and a complementary treatment is offered to this patient with passes with this obsession techniques. If he wants, fine, okay. If he wants to see his priest or chaplain or bishop or pastor or whoever or whatever authority is in his church, he will receive this visit, but the treatment is offered. Within the Spiritist Psychiatric Hospital, we offer conventional psychiatric treatment with drugs and everything, and the Spiritist treatment is just complementary. Alessandra is going to publish her thesis, and she's going to show that the Spiritist Center is really the place where you receive treatment for free. And we comparison. And in 1950, there was a hospital that became a general hospital in 1965. And when you have lay people treating patients, they became hospitals with doctors. And Alessandra is showing in her thesis that the Spiritist Center does that 7 days a week, 365 days a year. A majority of people that go to the Spiritist Center, according to the survey that we did, are psychiatric cause related and also related to depression. And we are halfway in this work, but we can bring results later on.